Hi, so my name is Jade Womack, and I am doing my video for skills training. So the mental disorder that I chose to go with is schizophrenia. I work for an MHMR clinic out of Odessa, and a large part of our clientele suffer from schizophrenia or schizoaffective disorder. So I don't do a whole lot of skills training. That's kind of something that I would like to start doing in the future. I've watched some of my coworkers do skill training. I've watched some of it during my field hours. So that's what I'm going to focus on for the video. So the skills training that I chose was I went through the slideshow over psychosis, and I really liked the behavioral skills training. So it's the assessment plan, modeling, behavioral rehearsal, shaping and positive reinforcement, and then homework. So a couple of facts about schizophrenia is that it affects men and women. Men typically develop schizophrenia at an earlier age. Between the ages of 18 and 25 is usually when they have that first episode of psychosis. So for my client, my pretend client I've chosen is a male. He's going to be 23 years old. He will have had his first psychotic episode around the age of 19. He will be currently on medications. We're not going to talk a whole lot about his medications. So he is going to a day mental health hab, which is half a day. And the issue that we're talking about is that he is having a hard time socializing with some of the other clients that are going to the rehab, and he'd like to develop some friendships. We've already done the assessment, so as part of the assessment would be part of the first time that I've met with him. So during the initial assessment, he's brought up to me that he really wants to develop positive relationships. He's having a hard time reconnecting to people after his first psychotic episode. He's lost a lot of friends because his hallucinations and delusions caused him to be in the hospital and have some erratic behavior. And so he's a little embarrassed. Some of his friends are like scared of him because of his diagnosis. So he's kind of hoping that when he goes to this day hab that he'll be able to develop those friendships. So during the behavioral skills training, that's what we're going to really work on. So the plan is going to be that we're going to work on introducing yourself to someone and how to start just a basic conversation. So we're going to do it through modeling. So I'm going to model for him some basic social cues like smiling, shaking hands, asking the person how they're doing, listening, listening. And then I'm going to have him do behavioral rehearsal, do some positive reinforcement or some shaping, and then we're going to finish up with me giving him homework. So I've already told my pretend client that when I'm done with each of the skills that I'm going to look at the camera. So one of the reasons that I really like this behavioral skills training is that the client that I'm modeling is actually mimicking a client that we serve on our ACT team, which is our assertive community treatment team, and they're the highest level of care at the clinic. They do skills training. It's not this exact behavioral skills training, but they do skills training off of the IMR. For this individual, they are doing medication education, medication management, they're doing money management, they're doing COPS-D because he does have co-occurring substance abuse and a psychiatric disorder, and then I kind of asked her how they approach him on these skills, and so I'm trying to mimic these behavioral skills within my own training. So my client for this video, so his symptoms of schizophrenia will be somewhat stable. He still will be talking about how he's still hearing voices, or maybe he's seeing some stuff. There may be some delusions and paranoia where he's worried that if he does talk to people that they're going to see right through him, or maybe some paranoia that he believes they're reading his thoughts or whatever that may be. So overall, in general, he's going to have his symptoms controlled. Now with him, the skills training is going to be really important because he's young, and so he's in his first few years of this disorder, and so this is going to be really important that I teach him how to handle this disorder, that we're working on these skills so that as he ages and he gets older, he can use these skills for the rest of his life. So just in this one training, teaching him how just to approach people and have conversations is going to set him forward for success as he continues to deal with the symptoms of schizophrenia, with the stigma of schizophrenia, and as he's going through his recovery process. So I'm going to now move on to, I'm going to skip the assessment part. The assessment part would have done at the clinic when he first decided and agreed to meet with me. So through the assessment part, we would have had him sign a treatment plan. Through the treatment plan, it would discuss all of the services that he's going to be receiving through the mental health clinic, the outpatient mental health clinic, and then within it, it's going to talk about the skills training. So during the assessment, I would have identified, where he's at as far as his mental health symptoms with the schizophrenia, and then his major goals. So the first major goal for him is developing the friendship. So that's where we're going to start.